Hey guys, welcome back to the hip mobility series. So this one we are going to start on our knees, like this, on a knee, call this just a kneeling position. Now one little tip is, this is going to force more pressure on your quads when your toes are pulled into the ground. Here you'll release the muscles here. So if you find you're very tight, and putting yourself in a position like this with your toes on the floor actually hurts your knees or joints and pulls on things that don't feel right, just simply bring the toes down. It's a pretty simple awareness tool and something that's important, especially if you're feeling pain and you're not really sure how to kind of get out of that. So what we're going to do is we're just going to start with our knees at hip width apart, and we're just going to do hip rotations. So keeping my upper body still, I'm going to push my right hip forward, right? And my left hip back, and then I'm going to pull my right hip back and my left hip forward. And I'm going to try to keep my upper body still as I do this. So breathing in. And it looks simple, but it's also it's always important to keep moving the hips back and forth like this. There's much more to the joint than we sometimes think. Next, what you're going to do is the exact same thing. You're just going to move out into straddle position. Okay, so your legs are out a little bit wider. Again, my feet are flat, and all I'm going to do is the exact same thing. So keeping the upper body straight, breathing in, pushing my left hip back, my right hip forward, breathing out, left hip forward, right hip back. So a pretty simple exercise. You might feel a bit more of a stretch inside here. This is what we want. This is awesome, perfect. All right. Next, what we're going to do is we're going to add a little variation here. We're going to come down on our elbows, okay, and I'll show you from the side. So keeping that same position that you just had with your legs, you're going to bring your heels or your ankles, and you're going to bring them on the floor in line with your hip. And from that position, you're just going to breathe in, keeping an arch in your back. You're going to sit your butt back as far as you can, breathing in, breathing out, coming forward. Arching first, so you'll notice here, arch, keeping the arch the best that I can, so we don't want to see this. We're going to push back and in. So again, 3 good breaths in that, and don't forget to hold at that end range if you're still breathing. All right. Then next, we're going to come back to knees are going to be about hip width, if just not a little bit wider than hip width, maybe even closer to shoulder width apart. And all we're going to do here is we're going to get our arms in what we call prisoner position. So arms in front like this. And we're going to go front, back, and side and side. And the hip is a tricky one, so I recommend that we just start with one at a time, and we don't start going, back and forth, side to side, that we really just focus on one movement at a time. So because of this camera angle, I'm just going to show you from the side here, or like pushing my hip to the side. So what I want you to do is I just want you to keep the upper body still and push your hip out that way. Coming back to the center, pushing it out. And if you feel like you're too wide, you won't feel like you can really move the hip. So you want to make sure, again, listening to your body, everybody's body's different, but there's general rules, guidelines, is keeping those knees about shoulder to hip, coming in. So breathing in, keeping the upper body still. All right, next one. From there, we've done both sides. We're going to do forwards, pushing the hip forward, keeping the upper body still, and coming back to neutral. Pushing the hip forward, coming back to neutral. Now from here, what we're going to do is we're going to do an arch. So from here, we're going to arch our lower back, and here you're really going to feel it in the spinal erectors, right by the spine here, and that's okay. Arch, and up. Arch, and up. Now it's important that you don't stick the ribs out like this when you do it. You really just want to focus on the hips pushing back and feeling that tension come through that lower back. And that's fine. Don't over squeeze it, especially if you've got back problems or anything like this, or you find that these muscles get too tense. Feel it, feel comfortable, and then pull out of it. This may be new to you, so it's new to your body, and you just want to make sure you take things a little slow. So after you've done all 4 sides, what you're going to do is we're going to move into hip rotations. Now, as you start out on this, it might not be fast, it might be a little sticky. So we'll start with pushing my hip forward, and then I'm going to come to the side, and then come to the rear, feeling that arch. Coming to the side, pushing this left hip out, both hips out, right hip out, coming to the side, arching, feeling it on the right side, now on the left side, pushing that hip out to the side, feeling some tension through here. So what you're going to start to feel is as you rotate the hip, you're going to feel more pressure dominant on one side. So as I come forward here, I'm going to feel more pressure, but as I start to center out in the center, I should feel even amounts of pressure here. And then as I dominate this side, I should feel more here than I do here. So listen to that. Become aware of that as you're doing the rotations. Alright guys, so this is the second video of the 3-part series here in the hip and femur. And I look forward to seeing you guys in number 3.